No, that was.
Oh.
Probably too, but
Yeah, I think we're on the live.
Are we live, Zoe?
Yes, live.
Oh, I have to give it. Yeah, see, say record up there. I'm not the host, you have to record.
Okay, welcome to December.
Yes.
Okay. Okay. Let me go ahead and call us to order. We don't have anybody for privilege of the floor, correct?
Correct.
Okay. Before we go to approval of the minutes, I just want to really quickly follow up on emails that you've been sending out about the sexual harassment training. So can board members, if you haven't done that already, can you please make sure, when is that due? By the end of the week? Yeah, by this Friday. Okay.
I have a question. Sure. Training done, the whole facility.
Yeah, there's a form you can just sign with the date and the name of the training. You don't
Mine
have to do
happened
it.
this time. It was like the most brilliant thing that's ever happened. The medical staff makes it do it.
Do they need to send you the certificate or anything?
Hoping they would.
Yeah,
Something happening, but it's okay, because I just jotted down, because I take their word for it.
okay. So if you
Put in my
do,
house training.
yeah, if you do have, or take a screenshot of it or something and just send us the. Okay. Let's move on to approval of minutes. Sorry for that. No, I did that. So, approval of the October minutes. If we could get a motion to approve as written. They were first from Melissa, second from Shauna. Any edits? Stuff there? Okay, all in favor? And that's unanimous. We'll move on next to, well, there was no financial summary in there, so.
Right, we've started to transition the financial report over to Jeremy Porter, who's our fiscal administrator for whole health.
Okay,
He's out unexpectedly,
okay,
so we didn't get a report printed off. I'm not aware of any really glaring things to bring up right now.
thanks. Any questions from board members on that? Okay, Dr. Claypack. And your wonderful summary of a trip to Indochina.
I thought it was pretty interesting from a public health point of view. Always makes you feel fortunate that we have such a public health system in this country that we can go out and eat, and drink the water out of the tap, and drive on the roads, and have so many advantages in that way. Largely coming from government action, I must say, and public services. So I wanted to mention a couple of things. I guess primarily about a recent summer tick surveillance, how that was done, looking at our region by the New York State DOH and sampling ticks and looking at trends in infestation of the ticks with some of the diseases that we're concerned about: Lyme disease, babesiosis, anaplasmosis. I think the bottom line is that for the public, they need to begin to think about taking a check of themselves within 12 hours, not the 24 to 36 hours that we've been using over the years, because anaplasmosis on this most recent tick surveillance had risen to 1 tick out of every 10. So if you get, if you get bitten by ticks enough, your chances of getting anaplasmosis is quite good. And for anaplasmosis, it can be transmitted within between 12 and 24 hours. Lyme gives you a little bit more time. 36 hours has been used. Anaplasmosis isn't as forgiving. And so I think we need to begin to check more frequently. And unfortunately, as I mentioned, 6 ticks out of 54 were positive for anaplasmosis. For Lyme disease, it was half the ticks. It was half the ticks. So you only need to get bitten twice, and your risk is well, it's 50% with every bite, but the more bites, the more chance that you're going to be infected. So that's the main thing I think we need. Unfortunately, too, we have warmer winters, and we can't, the public can't rest on the knowledge that we're into late fall and into winter. Whenever the temperature is above about 34 degrees, the ticks become active. So people need to take precautions all the way through all the winter. So that's the only thing I wanted to add to my report. If you have questions about the body of the report, I'd like to answer any of them.
Questions from board members? Okay, thank you. Let's move on to you, Frank.
The only thing really to add, that if anyone wants to get a tour of the construction, after the meeting, we'll be happy to show folks around. It's really coming along and we're into phase 3 now. So we're expecting it to likely be done by the end of next week. So the old home care space is now designed to be mental health clinic space. Offices are going up, have gone up behind us for Rachel's team. And then at the other end of the hall is the last bit, and health promotion and the community health workers are going to be co-located together in that space. So if anyone wants to see it after, we'd be happy to take them to it.
Any other questions for Frank? Okay, Rachel.
Nothing to add to my report except echoing the construction comments. It's had a big impact on my team in the last few weeks. We've all had to be remote in various ways or dealing with a lot of pumping and drilling. But anyway, we're doing fine. We're almost to the end of it and looking forward to moving in.
So are you going to be right behind us, literally right here?
Across that hall.
Oh, across there. Okay.
Yep.
I thought you
Not
said
the
you
conference
turned to
room.
the conference room.
No, their stuff is stored back there
Okay.
right now, so that's why the door is closed.
Any questions for community health? Okay, Sam, health promotion.
Want to add that, I apologize. We put in that we've come to a new name for the HITCH program, which is the New York State Community Health Collaborative Grant that we received last summer. And we have a new logo. So the new name is HIP Tompkins. It's Healthy Infants Partnership. And the logo looks like this, but we will include it in the next one. But we want to try to start promoting HIP Tompkins as the acronym. It's just a lot more accessible to people. People have no idea what HITCH means. And we think we'll just be able to use this on materials to promote the program further and continue to build cases and referrals. Just wanted to share that.
And Sam, can you remind me, where does that intervention start? Does it start in the hospital or it starts somewhere in the community?
So it can start before, while people are pregnant,
okay.
or it also includes it pretty much includes anyone of reproductive age. So if somebody is pregnant, if they have children under 2, or if they're sort of in between children,
Okay.
or could possibly become pregnant. So it covers a large swath of the situation. So we get referrals or connect people while they're pregnant or could be thinking about becoming pregnant. But then we also get a lot of referrals similar to for in conjunction with the mom's program directly from the hospital, for example.
Also, I wanted to thank you and actually a lot of the organizations who are at this table, just so folks know, on the Monday of Thanksgiving break for the colleges, we have at Ithaca College something that we call our Health Expo. And we bring just shy of, it's right around 400 high school students from the region that come to campus to learn about all the health professions. And the health department was there to talk about public health. Cornell was there with their master's program. The hospital was there with, and not just the hospital, but everybody was there. So it was a really great event. And I think the students were minds were kind of full with the opportunities and healthcare. I think that was really good for the region and really good for, us to sort of attract and try to keep people in the area for our workforce. So we wanted to just publicly thank you for taking the time to come to that event. What's that?
I was going to say the same thing to the college for hosting, really nice space and logistics all work and
It's amazing sometimes when that works, because you think there's no way this is gonna work, and then it does work out. So it was a really nice group of kids, and it was fun. It went very fast. It was a fun party, so.
yeah, so that happens every other year. And I also wanted to put a shout out to Theta Health. I went to a session about the laboratory sciences, and it was really fascinating. And I just feel like the students I was with were TSC BOCES, students who were in already like healthcare programs. And it just seemed very enlightening that there's this whole other world in the basement of the hospital.
Like that message back? Yeah. I mean, I think that was really the theme of the event, is that the students left like, oh my gosh, there's more than being a doctor and a nurse in healthcare, right? Which is the whole point, so. It's great. Children with special healthcare needs, I'm gonna turn it to you.
Capri has submitted a report. I don't have a lot to add. Their referrals are down for November. They're continuing to train 2 nurses. And we have 1 nurse vacancy that we're holding for right now, since we're still recruiting for a director.
Put the finishing touches on the job descriptions for the positions the legislature created, the therapists, so they're going through the HR processes now, so hopefully we'll be advertising those soon. And then we can evaluate who applies.
And the hire date is as soon as possible.
Yeah, I mean, one of the things that we want to be mindful of when we advertise is where the people are coming from. Right, because this was one of a couple of options that was proposed, and what we don't want, that we want to avoid if we can, is just taking from other local providers. And if that's all we get is applicants from that, then we may have to, step back and just rethink our strategy. So we're gonna move as quickly as we can, but we're also gonna be thoughtful about how we go forward.
And then, any questions on that? Elizabeth?
So there's a lot going on in environmental health. We've got our new office structure in place with 4 managers, which is creating a lot of changes. I am expecting I'll start submitting highlights like I'm supposed to in 2024 after this kind of settles out, and just start the year on a good foot that way. But so there's a number of issues with there's things going on with grassroots. There's more things with the vaping situation. So those will probably be coming to the board in January, I expect. One thing, Holly's not here, but one thing that I was thinking about is some of these things, especially connected with vaping, are like enforcement policies and things. And I'm wondering if we can do those like in an executive session, because I don't want to be people conveying to the public and to the people that we are providing enforcement against what our enforcement strategy is. So I didn't know if that was something I'd like that to be considered anyway, because if not, it's difficult to have some conversations when we're talking about enforcement against what our strategy and stuff is. Unless we don't want to convey it.
Well, there's only certain things we can do in executive session, so we'd have to consult with the clerk of the legislature and the county attorney.
Yeah, that's what it's, Holly's not here, but so if not, it does make conversations more difficult. If our enforcement strategy has to be public. That was one thing that came up, and then Adriel Shea is here today. He's a senior environmental health specialist, manager in environmental health, to help us muddle our way through the Applegate enforcement that's on the agenda. And with respect to Applegate, we realized in our discussions that we had an oversight, that we have the enforcement order, and in that we want to keep as it is, but in the enforcement order, there, he said,
Can we hold on, are we changing something about it?
the agenda.
Okay,
So I'm not talking about the enforcement order specifically.
Okay.
But he submitted a request to waive out the sewage system fee. That should actually be a separate action for you guys to address.
okay.
So I don't know if we can add that, consider that in tandem with the enforcement order. That he would like, he needs a new sewage system and the letter is in the enforcement order. That's why I mentioned the enforcement order. We failed to bring it as a separate action for the board's consideration.
You would need a motion to add.
I'm sorry for that.
Is that the extent of the?
That's it.
Okay, I just. Any questions for Liz? Okay, so we heard in her discussion a request to add something to the agenda, so is there about the separate request from the Applegate Park folks? So is there a motion to first from Ed, a second from Shauna to add that discussion? And it's a waiver for what? Just hold on.
Waiver for their sewage system fee. Their
This is for the waiver of the sewage system fee. Okay, sewage system fee. Okay, and so any discussion on that? All in favor?
Oh, we're already voting on it?
No,
Okay.
just
Okay.
add to the agenda. Yeah, just adding to the agenda. Okay. So I think that's two, I'll add that as, can I add it as a 2A or 1A? Sorry, 1A. Okay. All right, so with that, let's go ahead and move into our enforcement actions, and we'll start with the first enforcement number 1 on the agenda, which is related to Applegate mobile home park, which is a water related action. So could we get a motion to approve this enforcement action as written? First from Melissa. Second from Shauna. Okay, Liz, discussion on this, anything we need to know?
This Applegate has come before you guys before, it's in violation of Board of Health orders. It's been a very challenging situation all the way around. Overall, the owner is not generally submitting his water sampling reports, his monthly operating reports consistently. This has resulted in the park being on a boil water order since May of 2003. So staff, staff have to go out to ensure that the water system is still kind of okay. And,
It's since 2023, right?
2023.
Okay.
that was
It's
2003.
Sorry, thanks for the correction. So when we go out, chlorine residuals are generally present, right? So it seems like he's maintaining the system all right, but he's not doing the sampling or submitting the reports that he's supposed to ensure that the system is well operated. Now he is having problems with his on-site wastewater treatment system, and which is part of the waiver that you briefly discussed. He's also not submitting most of his fees and the penalties from enforcement orders, right? We've tried various approaches. He's currently operating without a mobile home park permit because of all of these things, which is also not good. So we have restructured the order, restructuring the penalty. We're essentially waiving more of the penalty if he complies with the requirements of the order. Do you have more that you would like to add, Adriel?
I guess you had mentioned that we go out and we've been checking the chlorine residual. We've also typically we do one bacteriological sample a year called a surveillance sample. In this case, we've done 3. Those have all been negative for contamination. So it does seem as though the system has been maintained.
And we've been trying to straighten this out in our heads internally. And I think roughly he has been assessed since 2019, roughly $4,000 in fees and penalties. And he's paid approximately,
I don't have what he's paid, but we've waived about 1,300 so far.
okay, and I might have,
They're not assessed.
just to kind of give you a sense of the, some of those are this. So I'm showing that he's paid maybe in the neighborhood of 1,550 since 2019. So a little bit less than half of what's been assessed. And then in the current enforcement, you want to explain the penalty, Adriel?
So order one would require him to pay $1,725 if he does not basically maintain full compliance through this next year. And that 1,725 is essentially the outstanding penalties that he has from the previous order, plus 2 late fees that were assessed to his public water system operator fee. Total of $550 there. Order 2 requires him to pay $400, and that is the outstanding public water system operator fees less the late fees, if that makes sense.
So he gets an annual mobile home park operating fee of $171 each year. It's a base fee to operate a mobile home park, and then it's based, then he gets additional for the 6, I think, units at his park, whatever, right? That's $171, and then there's a water system operating fee because he's a public water system of $200 every year. So those are the annual fees, and he's missed the last 2 years of the public water system operating.
Any questions from board members on this? All in favor is written. Any abstentions? Dr. Jillian, did you vote?
I have
No.
no video. It's just
Okay. Do you need, I mean, do you need a minute? That's what. Let me back up for a second. Can we revote, please? I apologize because I thought you were ready. All in favor is written. Any opposed? And abstentions, so unanimous. Okay, so let's go ahead and take up the separate action that we added to the agenda for the waiver of the sewage system fee. Which, let's just to make sure we're looking at the right one. It's this thing, right?
It's dated December 5th, 20.
December.
No, that's 2022. I'm wrong.
September 14th.
September 14th, 2020.
That's the right, okay.
Yes.
So it should, does everyone have it? It should look like
I know
this.
that's right?
Correct.
Right, brother. And it's at the end of the enforcement packet.
It's page number 14 at the bottom, with page number 14 at the bottom.
So he has an on-site wastewater treatment system that, because of the size of it, it is regulated by Department of DEC, Department of Environmental Conservation, as well as us. So he needs to get a speedies permit, and that governs his discharge, right? So he is out of compliance with the speedies permit on this. And so he has submitted him saying he's in compliance, but there's been I think he is out of compliance with the deeds. And we have verified that. So he has to pay a fee to us, and that's what he would like waived. That's $325.
$335.
$335.
Yes.
Why does he want it waived? Not that anybody wants to be waived, but
Why did he say so? He has no money. Should pay.
Can we back up for just 1 second? Let me put this under a motion before we have the discussion. Yeah,
Okay.
sorry,
Yeah, sorry.
that was my fault because I got distracted by reading too. So let's
That is good.
move to,
Motion.
well, what's the motion?
It's
Okay, no,
definitely
no,
additional.
so I think the motion is to approve the waiver of the fee.
Oh.
Okay, so a first on that motion, second. Okay, let's discuss.
Thank you.
Sorry, yeah.
You know, essentially what's in his
Yeah.
letter. Right, he's been having a number of difficulties, especially since COVID. Do you have anything to add, Adriel, on that?
Yeah, I mean, just he's expressed several times, hardship, as far as paying the fees and penalties. We've done a couple of payment plans with him before and they haven't really been successful. Does need to make a change, modification to his existing sewage system, but we don't want, the payment of that fee to hold up
Sure.
that correction, so we do support that waiver of that.
Is there a possibility of connecting that, like, we waive project is done, or if the project is not done, it comes back? Is it possible to put a condition in there?
So I think if he does not comply with repairing his sewage system, then we would end up taking enforcement action at some point, and that's when we could address any issue. I think I don't know that we would be saying you have to pay that we would revoke that
Fee, but
the
that would be
waiver, but we could assess it.
just for the fee, right? I mean, like,
Just for the
permit process would continue to
Yes.
make sure that it is appropriate. It's just the fee.
And so I'm sorry, I need you to back up for just a second, because I think I'm not understanding the relationship between this waiver and what we're waiving and the enforcement action. that we
They're
just did.
separate. They're separate.
So there's no
The
fees and,
outs fee is not included in the enforcement action,
okay,
right? So so he would owe the outs fee in addition to what's been outlined in the enforcement action you just took action on.
okay, and what's the total fee for this? What's this total fee?
$335.
This is $335. And he's asking to waive all of it, everything except $275?
So in the letter that he submitted, he requested that $335 be waived. And that we offer him a 50% reduction in the punitive fees for past enforcement actions.
His letter is covering both the enforcement and the waiver. The waiver and the enforcement and our actions are separate. So the second to last paragraph, if you insist there is a need for improvement to this tailpiece of the septic field, I request a waiver of all construction permit fees is all you would be considering in this motion. Everything else that's in there is related to the enforcement action.
Was addressed in that last enforcement action.
Does that help?
Yes. Yeah. Okay, and the amount of the construction permit fees is the $335? Okay, thank you.
I'm sorry, this isn't.
No, that's okay. I
We
just-
had a really hard time kind of figuring out where all of this lands on everything.
Okay, and so, we've waived for him before his renewal application, his late fee for the operating system. Oh, we did not waive it. Oh, we did. We waived his late in 2021. We waived things.
It's really hard to, and this is part of where we were having difficulty. We have waived late fees on multiple occasions, and then we've rolled other things into penalties that he's ended up not paying. So so that's where I was trying to get a general sense of that we have assessed, that he's been assessed about $4,000 in fees and penalties and has paid slightly less than that overall, separate, without including the sewage system, right? So if you're trying to get the overall sense, right, paid approximately less of all of the fees and penalty, less than half of all the fees and penalties that have been assessed. Most of those are probably penalties, or at least half of that is probably penalties that have been assessed by the board. I don't know if that helped. It's a really complex situation, both from a operating, I mean, the operating part and all the tracking involved in what he has and has not submitted and trying to get him to submit things. And then the financial end is been challenging on her. Because he's also had made payments that have been bounced. And so then they have to be reapplied, and it's a very complex situation. But we do support waiving this fee so that he has one less hurdle for putting in his sewer system.
So I will say I have been Team Joe probably for the past 6 months since we've been seeing a lot of these resolutions, and I'm having a really hard time because as a property owner and as someone whose primary concern whenever someone pays you the rent is to make sure that they're getting the things that they are promised in their lease agreement. It's our job to make sure that they're getting a safe environment. And whenever we keep tapping into these fines and these violations and things aren't getting adjusted, there does come a time whenever it puts liability on this county if someone gets sick or someone gets hurt. And so that's where my concern comes in. The other part of it is that by us reducing the amount of fees that this landowner pays to us, I mean, we have fees to pay our staff. And we also have fees in order to offset the amount of tax money that all of us put into our system. And so whenever we have one person that comes to us and asks for, half the fees or a quarter of the fees, it means that everyone else has to pick up that tax burden. And so I am sympathetic towards Joe in his situations, but I feel like at some point there needs to be a realization of like, this business model is not working. And so I guess I just pose that to everyone. At what point are we going to say, like, you're not able to provide a healthy situation for your tenants and the county can't help you anymore?
I would just say it is complicated, Shauna, because when we do reach that point, what do you do with the mobile?
I know.
home?
I know. I don't want to mow.
Well, I mean, it's not like you can't shut them down.
Yes.
Right, we've got people living
No, I
there, so it's really hard to decide what the best course of action is.
I just have a question regarding mobile home operation in general. Do most mobile home operators charge fees to each resident? Like, does he just need to raise his fee to each trailer on the land to account for? I mean, it's obvious that there's some kind of like system cash flow problem that he's dealing with.
I mean, it could be a situation of he accepts voucher or Section 8, and those voucher amounts of $400 aren't paying what it costs to cover the expenses to operate.
I think there are also complications from COVID where people did not have to pay rent. Right, I think that's the start.
But he's also expressed to us that, I mean, the mobile home park is small. It's just 6 lots. He occupies one of those, so he's only generating 5. And so it wasn't his sole and is not his sole means of income. And I think he was more impacted with his other means of income that was from the park itself.
Does he need a support group with other mobile homeowners? I mean, like, how does he get support from like the other piece?
Well, and mobile home parks are traditionally more low-income housing options in our community, so the rent generated, it's difficult to get more rent out of those for those lots. So it is an extremely complicated issue, and it's not just here, everywhere. It's the same way in Florida. The end result for us usually is we could close a business down, right? You placard a restaurant, whatever it might be. Closing mobile home park down, now you've got 5 families that have been displaced. Right, so we're trying to balance keeping it safe for them. So the water, as we know, we're making sure is tested and is safe for them to take. The sewage, if as long as it's not backing up into their homes or onto the ground, you know, there's repairs that can be made to make that work where there's not an imminent public health risk. So we are certainly concerned about making sure it's safe for the owners. It's this administrative stuff behind it that is extremely complicated. But your point is well taken, Shauna.
But from an EH point of view, right, it's also just not, he's not submitting the reports that we need to show that it's good operation. So there's so many factors going on.
That's my question is like, how helpful is he being in following up on his steps to make the system safe and make changes? Is he following through or is he not? And
But
if
he
he
hasn't been following through,
Right.
that's part of why we're here.
right, and
Right?
so
It's been inconsistent.
yeah, and to me those are steps that I'm sure there's a financial component, but are maybe not as significantly more expensive than the permits and the fines that he's facing. I don't know. I don't run a park.
So at this point, we're on the waiver
So,
for the sewage system. Right.
Correct.
Right.
Understood.
So
understood.
just to make sure we're all focused on that.
Right, but I think to the
$35
same, maybe in the same point that were raised by two of the board members. I think there's a hesitation about waiving this because we don't have a good track record with this individual that waiving actually gets us the results that we want. And so I think the modified approach that was recommended or asked about, which maybe we can talk about, which I think gets to both points, is can we agree to a waiver if something is accomplished by a certain time, within a certain time frame? Because I think just waiving it, but then not knowing that this tail piece of the septic field that needs to get put into place or whatever that the construction fees related to that. But even if we, permit fees, even if we waive it, there's no guarantee that we're going to get that. So would you all be amenable to an approach that agrees to waiver, but it has to be done within a certain, as long as it's done within a certain time frame?
I would,
So
I would,
that it is actually in the orders to complete the repair by January 31st next year.
I would probably prefer not to specifically tie the waiver to that. It's already in the other order and it becomes, it's very difficult tracking administratively when we have all of these contingent fees and penalties. If he doesn't comply, we'll be taking enforcement
On this one
on
anyway.
the, yes, we're not in line with the sewage system. So I'd rather have the waiver fee just be a straight up, whether it's granted or not.
Okay.
So when this comes up again and he doesn't complete this section of the septic, this sewer system, and I guess we need to.
So then we can
be
have
aware
another
that-
penalty.
Right.
Can you remind us that if we do
Yes.
waive it, that we've waived it in the past and this is what we discussed, so it comes back up.
Well, it should, I feel like it should go on the little chart for him, right? Which is that
Yes.
that this was the conversation, he asked for this, it's like similar to what we did in the past in 2021, and all the other times you've done it, which is that this is what was requested and.
So we can, so we can waive it contingent on him complying with the order that you just approved. Then we probably, that's fine to do, track that, if that's what you guys would prefer, if not. That would be okay. It kind of all rolls into what's our next enforcement action anyway.
Well, yeah, I mean, I think I was satisfied, for me, I was satisfied, I understood that we're capturing it regardless with the enforcement action. Even if we waive it, we're gonna capture it over here if he doesn't do it. I think for us, it's more just administratively, is it possible for us to make sure we add to this table of his that this request was made and that this is what we did? So that we remind ourselves if it happens again, that,
You're talking about the
When
case
it
summary.
happens again.
yeah, when it happens again.
Yeah.
I think we're referring to this table right here that you do, this nice table that you do.
So we can keep track.
Okay. Okay, any more questions or discussion on this? Okay, so all in favor of waiving the construction permit fee as requested by this property owner? Anyone opposed? Unanimous abstentions, okay. you. All right, let's move on to enforcement action which is number 2 on your agenda related to Station Creamery. This was the raw foods one, right? Yeah, raw contamination of foods. Okay, all in favor of the resolution as written? I'm sorry.
That's why I'm here.
Thank you. A motion to approve is written. First from Melissa, second from Dr. K and Dr. Diaz. I gotta give everybody the same props. This Ed, Melissa, first from Melissa, second from Ed.
Yeah, I can't.
I know, there's too many doctors and doctor. I can't. Okay. Any discussion on this? Questions of that? Okay, can I say?
Yes.
All in favor? All in favor. And that's unanimous. Okay, resolution number 3. Motion, this is the one for, this is hot and cold. Wait a minute. It's hot and cold. One was hot and cold and one was just, this is both, right? Again, for Love Kitchen, a motion to approve is written. First from Ed. Second from Shauna. Additional discussion on this or questions? Okay. Favor? All opposed? That's unanimous, no abstentions. Okay, resolution number 4, which is mix social dining, motion to approve is written. First from Melissa. Second from Ed. Additional discussion or questions?
I just one minor kind of administrative thing, that an incorrect inspection report was submitted. I have the correct inspection report for the September 8th one. They actually had 2 inspections anyway, so I have the correct inspection report. It doesn't change the substance, but if anybody wants to see the actual inspection report, I do copies of it.
Okay. Any additional questions or discussion on this? Yeah, all in favor is written. Anyone opposed? Okay, any other items we need to address before we adjourn?
Not to address, but just a point of information for the first action in January. You will need to appoint president and vice president of the board.
Didn't we do that already?
No,
Or did we did it last year?
we reappointed you last month. We
Okay.
recommended reappointing you last month to the board. So you guys, you could do it today if you want to take action, but at the beginning of by the beginning of next meeting, we'll have to have you vote for president.
Let's put it on the agenda for next time. So everybody who wants to step up to be president and vice president can think about your speeches. Okay. All right, everybody, we'll go ahead and adjourn with the completion of the agenda. I hope wish everybody a happy holiday season, and we'll see everybody in January.